Hey, everybody, which is currently nobody, but I'm going to go ahead and start. Oh, there's one person. Hi, my name is Renee Cooper. I am an Atlanta person. I'm going to go with personality or just a person in Atlanta. And I got my COVID-19 vaccine today. And so I was going to go through and do a live just to discuss some of the information that I have and a little bit about me and kind of document what's probably going to be happening going forward now that I have this, basically just documenting an excuse to do YouTube. So I feel very novice about this because usually I would do Facebook Lives, but I feel like this would be more broader reaching since I'm not really taking on any new Facebook followers. And I wanted to make sure this information was correct and accessible to others because it's definitely a very touchy subject of getting the COVID-19 vaccine, specifically with African Americans and Black people in America. So I decided that this would be a great place to document that. So a little bit more about me, if you don't know who I am. Again, my name is Renee Cooper. I live in Atlanta. That's most you're going to get about that. I currently have, since about April, been working for the Fulton County Board of Health. And I want to set a disclaimer now, and I'll probably say it later, that this is not part of my job, what I'm doing. This is something that I'm doing independently. It is kind of aligned with making sure that information is accessible and people know where to look for public health information about COVID-19 vaccine. But I am not doing this, this isn't a work project. This isn't something that I'm doing for the government or for my public health job. I'm actually currently temp there, hoping to stay on longer. But in the few months that I have been working there, I've learned so much. They were expanding their communications team because of COVID-19 and the extended help that they needed and support that they needed with communication about COVID-19, about testing, about the disease in general, and specifically how it was the resources and free resources that were being offered to the Georgia and Fulton County residents. So I will hopefully get much better at explaining myself going forward. But again, everything that I am saying, if I have opinions on things, they are my own opinions. If I am suggesting research, it's because I have seen documentation, usually from other public health agencies like the CDC and Georgia Department of Public Health, or any sort of medical or scientific information that I can come across, to share that. And I stress using that over and referring to medical and scientific documentation over just reading a news article, because the news is meant to be clickbaity. And while that is definitely my background is in journalism, I understand that they need those clicks. They need you to look at they're going to give you a clickbaity headline and talk about the basics of something and maybe give you a hint of professional references and information and resources, but they're not going to give you the entire full story. And there's a lot of misinformation that is going around. There's a lot of actual information that in the article is correct, but people are sharing it on social media with incorrect commentary about it. So this is a chance to be reminded that that's not okay. You don't want to share an article that, the headline may seem like doom and gloom, but when you actually read it, it has very scientific, important information that you just gloss over and you just made up what you thought was in the article. That's not okay right now. That can cause a lot more danger than it can help. It's definitely not helping. And while the intent is to make sure that people are as safe as possible when they are doing anything medical for themselves, whether it's a vaccine or getting tested or following any sort of public health guidelines, while you want to feel like you are on the cutting edge of information, sometimes you need to slow down and really do a little bit more research. Ooh, there goes my light. To make sure that you have everything you need. I'm going to switch this off. Switch. I was using a portable battery, and I should be using an all-the-time battery, like my laptop, which is not plugged in. So we'll see how long this goes. Ooh, okay. Much better and consistent, even though I have a bright spot on me. I will work on all of this. So while I have a very small audience, if there's any questions that you have, I know I haven't actually talked about the actual vaccine. So 6 minutes in, I'm going to talk about that. So I wore this really cute, I wore this really cute cardigan today. I'm like all pink, and I have my little bat companion, my tiny kaiju pin that you can't see. It's very glared. There he goes. But ultimately, just had on like a regular short sleeve, soft outfit, soft top, and I got my vaccine here. So I will upload the video. It is very short, like 30 seconds of a video that I grabbed that I will upload also to YouTube. And you can see just how quick it was to get this. So I keep poking at it and I keep going out because my arm is sore. So I feel so like in this general area. But this is very similar to when I got a tetanus shot some years ago, hopefully less than 10, but not too close to 10. And that's, pretty standard. So like moving around kind of hurts because I did have a needle in my arm. The needle looked a lot longer on Friday when I saw others get it than it actually was. The needle is maybe an inch thick. I did not measure it myself, but it's very thin and fine. And it was, I did not even feel it, the insertion part. I was very surprised. It was like a in, out. You can see her, but the nurse squeezed the stuff in. So scientific. And it was done very quickly. So, of course, this is dose number 1. There are 2 doses with the COVID-19 vaccine. My next one, so today is the 21st of December. My next one is January 11th. And I got mine through the Fulton County Board of Health. And again, I work with the communications department. So the phases that they've been rolling out, and I apologize if this has been out of order, kind of all over the place, but no one's really asking questions. So I'm kind of just speaking through this. The phases they're rolling out are by public health guidelines and state guidelines. So obviously the state of Georgia is making, the Georgia Department of Public Health is making the guidelines for how they're rolling out, which is very consistent with how other states across the country are doing it, which is making sure that in phase 1, they are vaccinating healthcare professionals, frontline workers, and volunteers who are managing COVID-19 testing, and kind of marginal people in that realm. So I'm very marginal, as you can see. I have gotten COVID-19 tests, but I do not administer them. But also, I do think it's kind of, again, while this is not a work project from a communication standpoint, as somebody who likes to be on social and to discuss these things, I think it was really important for me to go ahead and get it, just because it was, there were a lot of reasons that I decided to get it, but, it makes sense to help give clear information on what the vaccine is, what the side effects are, and even if I can't give them to you because I'm not experiencing them, I can give you resources to where to look. So actually, give me internet. Give me a couple moments. I'm going to update my Facebook so I can share this video, the video that I'm going to share on YouTube later of the actual shot. Like a good caption is shot, even though it's one shot. Actually, that's not a good step. Now you're here with me looking at statuses, so thanks for tuning in. I'm going to go with something I thought was really funny before, which is if you ain't taking shots, get the F out the club. No, dot, 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 literally. It may not be that funny to you, sorry. But like, seriously, don't. Spell things correctly. I have no idea if this is breaking some sort of protocol with YouTube Live, but you're here. We're here. I'm almost done. YouTube. YouTube. I wonder if this same number live on YouTube talking. All right. Loop. Paste. And capitalize that for accentuation. All right, that's done. Maybe we'll get some more people in the house. What is this? That's what I wanted to do. To trash. Apparently, I already tried to post this on YouTube incorrectly. Okay. Now it is posted correctly. Yay! All right, so what I will do is go through all the past moments. I have no idea if you're going to watch that. You can skip ahead. Maybe I should put that in the description where people can skip. That'll be pretty helpful. I'm going to learn some new things, like not to make this part of my face shiny because my ring light just like gives me a third eye. Oh no. Well, of course I made up. I messed up. I have no idea how I did this. Oh, no, don't. All right. I definitely somehow posted twice. I think we'll be okay. But like, we may never know. I still have notifications from posts I deleted, social media. Okay, so what I will do actually is go through and read some of the questions that I got from my post earlier today on Facebook. The first one was friends only. So if you try to add me on Facebook, and I don't know you, just don't at this point. But if you have Instagram, I'm happy to follow or be followed on Instagram. I don't post as often there, but I think it's just easier for me to manage people and other people's posts. So I'm at PeachyCon Princess on Instagram, or at PeachyMate on Twitter. I also don't mind Twitter. So this morning I was talking about, today's December 21st, all Black people got their superpowers. Of course, mine is always the ability to make amazing forms. I'm form goddess Renee. We'll get into that some completely other time. But also I was joking about my powers are pending because COVID-19 vaccination, all that. That's power. That's powerful. So I had questions that came through. One of the questions was, how was I able to sign up for it? Where did I go to determine eligibility? I'm listed in this person. I'm listed in the first wave of people to be eligible for it, but I have no clue how about getting it. Okay, so in Fulton County, Georgia, Fulton County Board of Health, backtrack. So Fulton County Board of Health is just recently, actually, we're going to be, and you would think we're part of Fulton County or City of Atlanta, but it's Fulton County Board of Health is actually part of Georgia Department of Public Health. So Georgia Department of Public Health is giving the information about where to, they're rolling out the different phases and have decided that phase 1 is going to be for healthcare providers and frontline workers and volunteers. So we have created, I helped a lot, actually. We created a form that allows physicians and people who run or are part of medical practices and long-term care facilities to sign up to be in line, to be informed about a schedule for getting vaccinated for not just them, but for their practice. So it's for kind of like smaller practices. If their practices are too big, they're going to have to sign up, I think, to be their own provider of the vaccine. But this is to help physicians get get in line for that. That's the most information I know. They take information out, and that's so Fulton County Board of Health. It's Fulton County BOH.org. You type that here. And it has weird extensions. So if you click it and then click the 2019 coronavirus tab, and underneath that it says COVID-19 vaccine, you will see information about the phase 1 rollout and the form where you can fill out the information to be on the list to get vaccinated. So it will ask you if you are a medical practitioner or if you are filling out the form on behalf of a medical practitioner. And if you say no, you can still submit the form, but you will probably, you're probably not in that tier 1. So you'll have to wait, but you'll also need like a license number and different things that, the criteria is there that you'll need to enter to show that you are actually a physician or from a physician's office. So that's the best way I know right now for Fulton County specifically to get in line for the vaccine. You can also check the Georgia Department of Public Health website and just look up COVID-19 vaccine, search it, and see if there are, I know that there's other counties that are part of the board, different boards of health or health departments that are taking this information, maybe not in an online form like we are, which is really cool, but definitely taking it either through a call, email, something like that. And then someone should be reaching out to you after that. I should probably respond to this person because I don't remember him saying that. I remember him saying that he worked in the first tier, so COVID-19 vaccine. Is that correct? I hope it is correct. Who knows? Okay, so that's question number 1 that I got from this. And then someone said, it seems to be getting assigned at the company level. If you work for a designated health company agency, you're on the list. That about right? Not completely. Again, you would need to register or give your information. It's probably a good idea for the main physician at your company to give their information to the state in order to get on their radar and on their list to know that they need to allocate vaccine, because there's not a lot right now. They only have so many doses that came into Georgia, and got to split that up throughout all the counties. I don't know the exact number. There are news articles that talk specifically with Dr. Like the Fulton County Health Director and Dr. Holland, who's at Fulton County Board of Health leading the COVID-19 leadership and efforts. So if you kind of look at the news, would have a better idea of numbers like that. But more likely than not, if you have a main physician in your practice, they should probably be reaching out to the state in order to get information about having things allocated to them if they don't already know that. Please say this is the correct one. All right. So another question that came through was, this is a question, this is a statement. It says, and I get mine before Trump, and you get yours before Trump, me, and Biden. He's this afternoon. It's apparently Biden and Kamala were this afternoon. That was this morning, like 10 o'clock. Can't wait to see the magic you are going to send out. I mean, it's magical, kind of boring information. And as of right now, it doesn't seem like anybody's really watching it. But ultimately, again, hopefully this is more of a documentation of this whole process, and maybe it will help somebody. Some people excited, woo! Someone asked what my superpowers are: telekinesis, visibility, or just a sore arm. Right now, it is just a sore arm. So I haven't taken off the Band-Aid. I probably could at this point. I mean, it's been since 10 a.m. I don't want to do that on camera because that could be gross. Let's see. And some people just said, like, right on. So someone also was against it. They said that I should not get the vaccine. And I asked what their sources were, and they said that their response was, it takes years to develop a vaccine. They have to do trials to see all the risks and side effects. Plus, it has mutated. You're not a guinea pig. Please wait. And I'm not a guinea pig, so I appreciate that. And keep saying, and I'm sorry. So there were some really good responses from other people, probably also in the medical field, who responded. One response was, the vaccine took both months to develop and years to develop. Scientists have been working on vaccines for COVID close cousins, SARS and MERS, for quite some time, and already have the basic template for vaccine involving coronavirus in that branch of the family pretty well sorted out after working on it and refining the science for close to 15 years. So this is true. Again, you should definitely check the CDC for information about the trial that they're running with COVID-19. But on a very basic level, yes, even though coronavirus is new to us, we all, well, not all of us, but a lot of us remember SARS outbreak. That was really scary. Maybe less of us remember the MERS, no, I'm saying that wrong, outbreak. But this coronavirus has been around for a while. And that's why, like, when people were looking at their, like, Clorox bottles, they're like, it says coronavirus right there. It's like, because there's different types of coronaviruses. So they've been testing all of this for a long time, for years. I like to think that scientists, like all of us, are doing our jobs pretty consistently. Doctors as well, so that when new things pop up, it's not just brand new. We're not dealing with just a general clean slate. We're dealing with, and me, I'm not a scientist, unless you, social media scientist, maybe, digital marketing scientist, anime scientist. But they have been looking at the effects of coronaviruses for a long time. And while this vaccine is based off a newer strain of a coronavirus, COVID-19. They have spent, I'm sure, every waking moment of every working day through the announcement of this being a pandemic until very recently to make sure that they can get a vaccine out. And the trials have, again, Google is your friend, CDC is your friend. They have tested tens of thousands of people to get the results that they have now. And I think that says an absolute lot, because still only, not only, but there's still such a small percentage of our population that has COVID, that has caught it. So to have, I'm trying to say things without coming across as being like, I know all these things and I don't I don't remember all of it right now. Basically, I trust that the people who are doing and creating the vaccine have, they know what they're doing. And trust is very important because, as a, I was definitely in the, I'm not going to get the vaccine. I'm going to wait until everybody else gets it until I get it. I'm going to wait 6 months. I don't mind wearing a mask for a whole, for the rest of the year. I don't mind this and that. Tuskegee was a big thing. They were using Black people as test subjects. We'll just come out and say it. And that is very scary. But we have to put more trust in the agencies that have been working not just with the Black community, but are made up of the Black community, made up of Black doctors, of women doctors and scientists and professors who are making sure this is universally going to help, not testing it. I mean, if you go back and look, they were having a hard time finding African Americans and Black people to actually do trials on, because that part is scary. I don't think I would sign up for that part. And to me, I'm like, why would they need to do that if, white people have diabetes? Why do a Black person with diabetes have to be, what makes us different? Is there a difference? But ultimately, it's just that there is history there, and you can't ignore the history, and you can't get mad at people for being scared about that. Sorority people who are scared for whatever reasons they have, whether it's just something that they may have heard or an experience that they actually have had about vaccines in general, of all races. And, really the cure for that starts with the research and knowing where to look and being more focused on the public health side of it and not the news side of things. But also you have to put at least a little bit of trust and your own sense of wisdom into the things that you're going to do to your own body, or let somebody else do to your body, because after that's really the end game. If you don't have trust in the person giving you the shot, or the person who brought the shot into the facility, or the person who put it in the bottle, you just got to let go sometime and just trust that this system is meant to help us, not hurt us. But that's hard. It's hard to do when history has proved otherwise. But because of that, everybody's looking at those possibilities so strongly. And, new crazy things could pop up. But at this point, there are so many eyes on it. When you're looking at negative feedback or very scary new information and you don't read it thoroughly, you really have to look like, okay, where is this coming from? Is this tabloids? Is this news? Is this, did I read a headline? Like I mentioned earlier, did I read a headline and it said one thing, but then when I actually read the article, it is explaining more details of why I should not be worried about what the headline told me about. That happens all the time. So there were a couple of resources that were shared, again, in the group about, through NPR, this one through YouTube. So again, even though I'm talking to you right now, you don't have to trust anything I'm saying because this is YouTube. I am a communications person. I am not a scientist. I am not a doctor. And you don't want to fall down a rabbit hole, because what I have found with social media is that, and specifically with YouTube, when you look at something recommended, like I hope that the recommended, because this has COVID-19 vaccine in the title, I hope that the recommended videos that this sends you to are not scary propaganda about anti-vaxxing. There's always a chance it's going to be it, because that's what people are going to always look for. That is the recommended algorithm, and it kind of sucks. But again, I'm here, if you're watching this far, to tell you, don't fall down that rabbit hole of people who are not professional in the realm of giving information, specifically about science or medicine. So again, you don't even have to trust me. You can be totally, but I will at least, if you were to ask me, send you in a direction where you can hear from somebody who I would trust and I have met or seen in person on some occasions, to give you better information about this. One of the first person I saw get the vaccine, and I will link to that video as well after this, was the district health director of Fulton County Board of Health. She is a Black woman. She has helped with pandemics and epidemics across the world. She came out of retirement to work for Fulton County Board of Health like a month after I started working there. And she has been incredibly knowledgeable and very even approachable about her thoughts and her knowledge. And that meant a lot to me, to see a Black woman in person with my own eyes getting the vaccine. Because and again, I know it's a dose 1, day 1. All I got to go with and tell you guys about is some soreness in my arm. But I will tell you, when I was in the room, so again, I saw this first getting done to the group of doctors at Fulton County Board of Health on last Thursday. And they have a tiny little vaccine bottle that they did not want to close up on, because the news media was there, and they told them not to get a close up of this bottle because there have already been counterfeits created. And anyone that works with like conventions and stuff, you know that it's so easy to like make a badge and just like recreate. People on the internet just have too much time. But this bottle is like so small. It's like those little the bonbons nail polishes, remember? And there's 5 doses in each vaccine vial. So when people are like, oh, well, they're doing this for this group of people, this for that group of people, like there's definitely a mix of people. There can be a mix of people getting a vaccine from the same bottle. So if it's affecting one person, it's going to affect another person. What else about the 5? It's kept, this is the Pfizer, didn't mention that at the very beginning. So it's got to be kept super cold. So the location that we have it at has a super freezer to do that. But it was not cold when it went in my arm. But it means that they only have about an hour before they can actually, before the vial is no good. They have to use it within an hour. So they have to have at least 5 people in like queue to get this vaccine. So there's a lot of structure and scheduling that goes with this. I think that's really interesting. And I had to, after getting the shot, had to wait for 15 minutes before I left so that they can monitor me for what's aphylaxis. I'm going to say that wrong, but like for allergies. I've had an allergy to the vaccine. I used to know this word. I knew it like moments ago, but now I don't. But very strong allergies where your like lungs cannot function. That has been, and I don't mind sharing those articles, but like that has been an issue with a very small amount of people. A couple of people knew that they had it, and or like knew that this was a concern for them. Anaphylactic? That sounded incorrect. I think it's anaphylactic shock. People who may have that, they should not to get the vaccine. But they want to monitor people for 15 minutes to make sure that they don't, have that. That's not a problem. If they have had allergies in the past or are immunocompromised, usually they watch them for about 30 minutes after that. But after 15 minutes, I was good to go, and I left. But yeah, that's part of the whole structuring and scheduling that they have going on. And yeah, after Dr. Paxton got hers, there were two other doctors that got theirs, and then a Black woman and Black man who also worked at Fulton County Board of Health. And it just, anytime you're in the room with, being in the room with Black people talking about it, it's really two parts of conversation. One conversation is, well, I wasn't going to get it, but, I talked to my family and no one I know is going to get, they're not going to get it because everybody's nervous. So I figured I would just get it. Or people who are like, I'm definitely getting this because I need to show others that it's okay. And I'm happy to say I'm in group 2 now. It wasn't always that way, but if this is going to help us move forward, then I think that is so very important because, you don't have to see me and think that I am doing anything so crazy or brave, or, you could think it's dumb. You could think that I'm acting as a guinea pig, but I'm ready for us to get past this and get onto the next part of our lives. And if I can help give that information to if I can help give that information to the public, but also help give information to the medical teams that are monitoring this, then I feel like I'm helping. I'm doing my part. And, sometimes it's, it's like the Rosie the Riveter of vaccines. Before I go, because I know that my computer's going to die, and I've been talking for over 30 minutes. So one thing that they do have, and I've talked before about trusting in the agencies that are making this possible. One thing that they have is this, it's not an app, it's like a portal called VSafe. And VSafe, that's VSafe, very safe. I think it's vaccine, I don't know. But it will monitor, and you can use it to monitor any symptoms or side effects that you're having. So about, 4 hours after I got the shot, so I got the shot, I was waiting in the room for about 15 minutes, and I downloaded the app and signed up for it, or the portal, signed up for it. And they were like, okay, so you're on this day, your next date to get a follow-up is on this day, and we're just going to check in on you to make sure that you're okay. I was like, cool, portal, thanks. So at about, 2:00 today, they sent me a text message, and they're like, hey, time for a check-in. And I was like, whoa, okay, cool. And they're just like, you have any issues? You have any soreness in your arms? You feel fever, any of that stuff? And I was like, nah, I do got that arm soreness. And they're just like, that's cool. They didn't have that sort of conversation with me. It was like a form where I just said what was happening. And I think that's really amazing because it means that everybody has access to the same portal, and they're checking in on people so regularly. I think they're going to send me a message like once a day for a week. And then I get my next dose in 2 weeks. 3 weeks after that. So I just think that's really cool. So it shows that as soon as something goes down, as soon as somebody is feeling not normal, they can ping that and they can make sure that they know where to go to give that information. And it's universal. It didn't ask me my demographic information. It just said, you're this, did it? I don't recall it asking that, but it was, I had to give my contact information, and they are able to yep, there it goes, dying. They're able to monitor. So I think that's really important. So anyway, I'm going to end this video so I can upload the video of me getting the actual shot. Feel free to ask any sort of questions, and I will do my best to link to the best resources. And if you are nervous, that's okay. There's still some time before it rolls out to general public. If you are just against it, that's also okay. But just know that there are resources and public health guidelines that you should be following to make sure that you're not spreading this and, adding to possible mutations and things like that. So do your best, stay safe, stay well, have a happy holiday, and I will probably check in again tomorrow just to give you an update on day 2. So, all right, cool call out sign, moe YouTube. I'll work on that. All right, talk to you guys soon.